Hello, I'm Maria Hall-Brown. Today we're tackling some pretty interesting subjects. Setting aside the complicated issues around gun ownership and Second Amendment concerns that have become political talking points, gun violence affects all of us. And today we're talking about a new approach or a new understanding, the impact and exactly what we should consider. A public health approach. I'm delighted to be joined by Michael Feuer, former LA City Attorney, who is now running for Congress. Lovely to have you here.
Nice to see you.
And our wonderful council member from the 10th District, Heather Hutt, who also, as we all know, worked with Kamala Harris with the state Senate. And of course, the director of LA County Public Health, Barbara Ferrer, a remarkable group of people with a wide array of information that we're really excited to learn and share about. Now, you all have had careers in public service, but your relationship or your personal experience with gun violence is very, very unique and different to each individual. So what I'd like to do is understand your perspective. And I'm going to start with Heather, because your perspective is a very personal one.
Thank you, Maria. Thank you so much for even having this topic as a part of a broad discussion. My experience is personal because 2 of my 3 sons were actually shot by gang members. It was a devastating experience. They were all in college and they were out with friends for a birthday celebration. They went to a club because they were all in college. And one of their friends didn't have the proper ID to go inside this space. So they couldn't leave them outside. They were like, we'll just go back home. And as they exited, they were confronted by gang members that wanted to take over this space as a badge of honor, basically. And that did the whole what set you from. I'm sure you're familiar with that, Mike. And they said, we don't have a set. And then the next part of the conversation was, well, then you don't respect it. And as my children have told me, that the friend of the gunman kept saying, do it, do it, do it, and pulled out a gun from his waistband and just sprayed everyone. Oh. 6 people were shot in that case, so that's considered a mass shooting. The police were not in the space, and this was a popular location in Long Beach where you have the Bubba Gumps and the P.F. Chang's and the Aquarium of the Pacific. They went there and they had dates because they thought it was a walkable space and a safe space. So it took a while for the police to get there because they didn't naturally patrol that area. And once they got there, my oldest son was hysterical, and this speaks to mental health and trauma because he's been protecting his little brothers, since Sandbox. So he couldn't do anything for them. The police thought that all of them were part of a gang, so he treated them like assailants, not victims, before they called the paramedics to do the proper transport. And my oldest son, who was hysterical, they threw him in the back of a police car and tried to tase him because he was afraid of the lives of his brothers. So, there were so many events that happened that night to get to the hospital to find my children because they were separated, different hospitals, and then to understand the aftermath of gun violence. It doesn't end right there. It still now the trauma comes up. They're getting sure-footed now, but they wouldn't go out in public for quite some time. There was a lot of healing and wound care that had to happen. Fortunately, I had good insurance and they were in college, so they qualified for wound care, but a lot of wound care happened. I remember one time going into a doctor's office and I'm pushing a wheelchair with one and the other one is on crutches and the third one is carrying bags. It was like we were a hot mess, but we had to push beyond that. And one more thing I want to say is that my child, the one that's paralyzed, was told he could never walk again. And, you know, he wouldn't capture that in his heart. He wouldn't believe that was going to be the rest of his life. And the next morning, after we went through surgeries and so on, and, you know, his body had genes in it, because when the bullets went, the genes went, and so they had to pull the denim out of his body. He said to me, I was like, how are you feeling this morning? All those things. He said to me, Mommy, we have to do something. And I was like, what? You know, what, you need water, ice chips? Like, what do you need? And he said, we have to help people, because this kid had nothing else to do today. He didn't have a plan. He didn't have any goals. And I just couldn't believe it. Mm-hmm. I was already working in government. I was already working in the assembly. And I said, you're right. And I guess that made me push, you know, how much work I can do from inside government for other people, so that they don't wake up and believe that they need to be a part of a mass shooting the next day.
Right.
Fortunately for me, there was a Long Beach gang task force, and they caught the young man that same night. Mm. And he was prosecuted and is still in jail now. But it's unfortunate that it was their goal. And that's part of the crisis, is that you want to take over territory to claim it for yourself, and you don't care about human life. Mm-hmm. And actually, the reward for shooting these humans was that you took the territory.
And to your point, you know, the scope and the scale of the aftermath and the reasons this happened and the ramifications of what happens is a lot broader than I think a lot of us really step back and look at, which is why we're having this conversation. And Michael, you know that very intimately based on your experience in the city attorney's office and other things that
yes, and before. Look, I want to say none of us has the experience that Heather and her kids have had. But we've each been touched by gun violence in different ways, and that's inspired, I think, each of us to pursue this incredibly important issue with some real intensity. I remember when I was on the city council, the North Valley Jewish Community Center shooting took place. And because I had a police badge from my council work, I was able to get past the police tape and get to the steps of the center just in the aftermath of the shooting. And I encountered two parents whose son, 5 years old, had just been gunned down by a racist who had gone through the community. He'd killed a Filipino-American postal worker. Then he trained his guns on little kids. And, you know, this is not a press conference moment for an elected official. The parents said to me, would you please join us? And we went to the hospital together and sat in a waiting room, much smaller than the space we're occupying now, to see if their son would survive. I mean, my daughter was the same age at that point as their son was. And it was an incredible, he did, by the way, survive, and he's grown up and he's done important things in his life. But when you're in that setting and you see the anguish on the face of those parents, and as a dad can empathize with that, it changes you. And I also want to say, you know, as city attorney, I was very active nationally, helped co-found the first ever prosecutors coalition to focus on gun violence. I was on Capitol Hill at a press conference after the Parkland tragedy happened. And we were there with key public officials, US senators, and the Parkland kids. And one of those kids stood up before international press and said this. She was 16 at the time. I was in my Holocaust studies class when the shooting started. My friend Nicholas, just across the aisle from her, fell to the ground. I was very confused, didn't know what to do, so I fell to the ground too, just to mimic what happened, maybe to protect myself. But the bullets kept flying. So she said, she pulled Nicholas's dead body over hers to shield herself from the gunfire that wouldn't stop. And then she said, I had to apologize to his parents, who obviously said, no, you did the right thing. We talk about gun violence often in this nation in fairly sanitized terms. there's a statistic, there's a shooter, but we don't speak about it in these terms, in ways that should, shake all of us up and compel us to take action. I've often talked about gun violence in the theme that we're talking about today as not just a public safety issue, but a public health issue. And because it has many different dimensions to it. We know, for example, that there was a recent mass shooting in Maine where the shooter had mental health issues. Sure. Federal law isn't tough enough on that point. We have gun violence that is perpetrated by kids sometimes who get access to their parents' guns. In California, my office prosecuted situations where adults had guns that kids brought to school. We should be storing our guns safely. The trauma that affects kids is an understated issue for all of us. We created in my city attorney's office a program that intervenes with kids who are even aware that a shooting happened near them, because kids' brains don't develop the way they were biologically intended if they're involved in traumatic events on a meaningful basis. And we have to intervene with them right away. We need, as all of us as Americans, as members of a community, not just elected officials, to recognize the pervasive impact that gun violence has been having on every segment of our society, and not treat it in the polarized way that you mentioned earlier, but treat it like there's some common ground here. None of us wants our kids to suffer.
Right.
None of us thinks that people who have mental illness should have access to weapons. None of us thinks that kids or criminals should easily get their hands on a gun. So let's find that common ground and view this issue the way all of us want to, with the kind of intensity and passion that we bring to other issues in our lives, because this issue has touched too many people.
And I'm going to follow up on that with Dr. Ferrer, because, it is, your office has talked a lot about the fact that this is a public health issue, because although we've discussed these horrific experiences that both you have been witness to with gun violence is even a broader category than that. There's personal harm that is being done, suicide rates and things that we don't necessarily hear about in the media as much. And gun violence as a public safe issue is one thing, but as a public health issue, how can we get that message across? And what is it that your office understands, given where you sit, that we're not talking about enough?
Yeah, thank you so much, Maria. And I also want to thank Councilwoman for her courage. I think it takes a lot to take a horrifying personal experience, have the courage not only to talk about it, but to do things to make it better for other people. So, I want to acknowledge and thank her, and I'm also sorry. And I want to flip a little bit and talk about something that I think is really hard to wrap our hands around when we think about gun violence. I want to talk about, I was a high school principal for a while. While I was a high school principal, I had 2 students in my high school who committed murder. They shot and killed other people. And as the adults in that community, that school community, if you had asked us to pick 2 students who were likely to commit this horrific act from which there's no return, those 2 young men would not have been on anybody's list. I had a district high school. Lots of my students had complex lives. Many of them were not academically achieving, but these 2 young men, when they were at school and attendance was again sporadic, followed the rules at school. Even the ridiculousness of some of the rules, take your hat off, put your cell phones away. I mean, these are common rules in high schools. But when they left our community, our school community, there were a different set of rules by which they were playing with. And as adults, when 15, 16, and 17-year-olds are murdering other 15, 16, and 17-year-olds, there's a problem with the adults that needs to be acknowledged. These are children who are killing other children. And that is why we call this a public health issue, because there is a prevention side of this that acknowledges the impact of trauma on the lives of people in our communities, that talks a lot about healing, but does not accept that it is inevitable that people will kill each other. You know, there's been, in 2022, I think there were over 800 people who died from gun violence in LA County. And as you noted, about 300, I think, and 50 of those were suicides, which is an issue we also need to pay attention to, the self-harm aspect and the harming others aspect. The rest were homicides. That's a outrageous number for a community the size of LA County, and destroys, as I think Mike so eloquently said, destroys the very fabric of all of social cohesion. It creates fear amongst everyone. It creates enormous trauma amongst those who experience violence, witness violence, and live in communities where rates of violence are high. It makes us doubt our ability to have relationships with each other that go beyond our small, very small networks, which again, disaster for us trying to create togetherness so we can care for each other. We're in this together, which is what we all need in order to both thrive, but also to move forward with an agenda. I think the reason in public health we want to shift this from just thinking about the public safety aspects is because we want to make sure we're preventing people from perpetrating violence.
So, although this is a unique situation, there are precedents when it comes to public health concerns. How do we take the fact that this is an issue that is affecting more of us than we are actually acknowledging? Because as you're telling your stories, I'm sitting here thinking of our family, which is unrelated to someone perpetrating a crime on someone, but my nephew's father committed suicide by gun. So you're thinking of it's everywhere. How do we get that message out there? And then what happens? What are the tools, the preventions, the safeguards, the things that need to be put in place from everyone's vantage point, because you all come from very unique perspectives, to actually do something or to make it loud enough and relevant enough that we will, in fact, start moving in this direction versus just arguing about gun laws?
Well, see, here's the thing. We know that there are certain people who are more likely to commit gun crime, commit acts of violence altogether. There's an approach called a risk-based approach to firearms policy. So let's talk about who's at risk and how different jurisdictions deal with that. So we mentioned earlier, people who have incidents of mental health crisis are more likely to be some danger. People who are mentally ill are not more likely to commit violence, but there are moments when they are at acute risk. And we know we should be removing guns from that equation. At the federal level, the laws are very loose, and as opposed to California, where if someone is, for example, in a mental hospital or is even perceived by their peers to be a danger to themselves or others, a gun can be taken away from them. There's a laws are called red flag laws that are prevalent now in many states across the country. California says if you are a violent misdemeanor, a person who can, it's not just a felony, but a misdemeanor, and has acts of violence in their background, you can't get a gun. Federal law is much looser than that. There are ways for us to contend with these issues. There's no federal law that requires folks to store their guns safely. By contrast, in California and in Los Angeles, there is. So I think it's really important for us to recognize that there are preventative strategies that are based in science, based in facts and data, that will help curtail the gun violence that is so pervasive in our society right now. So the question is, how do we find that common ground to recognize that we can get past the issues that you mentioned at the outset that have stigmatized the issue of gun violence for some people who oppose those changes in rules, and say, wait a minute, Barbara says, refer to prevention and suicide, for instance. Suicide, a huge gun violence issue for us. So what are the ingredients that are in that equation that we can contend with? We can require guns to be stored safely, for example, in homes, so a teenager can't get easy access to their parent's weapon when that teenager is suffering through some traumatic moment in their lives. And speaking of trauma, we can intervene with kids when they're exposed to gun violence. Because, look, the brain science used to be that if you see an act of violence or are victimized by it, you are more likely to perpetrate violence later on. And that's true, but now the science has evolved a lot more. As I said earlier, we know those kids are never going to have their brains develop the way they were obviously destined to. So we should be intervening with those kids right now. I am so passionate about this because there are strategies that we know work. The question is how to get from the idea to the reality. California has been a leader in this. The federal government needs to take much more concrete action in ways that don't implicate some of the polarizing discussions around the Second Amendment.
So, as you said, there are this tool of destruction, but there's also people in this scope that are affected, but may not have any interest in the tool. They don't have guns, they're not around guns, that's what happened with your family. That's what happens with a lot of people who have been affected by this. So looking at it from a public health standpoint, where can we, elevate the conversation so that all the necessary preventive things can happen and all the necessary programs that can go in to adjust everyone's thinking about it, I guess is what I'm trying to get to. Because you're right, there are things you can do in terms of the tool, but what can you do to make this everyone's issue?
There has to be cultural change and there has to be a societal change so that it is a part of the conversation that we do need to talk about gun violence and gun violence prevention. Fortunately, I traveled with the mayor just a couple of weeks ago to D.C. and out of the White House in the Office of the Vice President, there is a new department which is called the Office of Gun Violence Prevention, where they'll be putting federal resources behind gun violence prevention. That's great. The legal piece is great. The whole thought that the White House sees this as a problem nationally is really important. But at the grassroots level, we have to change what is culturally acceptable. Why is it acceptable for 15-year-olds to be shooting each other? Why is it acceptable for the young men that shot my kids to claim a territory for their set? And there was a lot of racial things that went on in that conversation back and forth. And why is any of that okay? Why is that a part of the culture that we kind of turn a blind eye to? We can't do that any longer. It's detrimental to our society. And all of us are working really hard to make change, to make it non-acceptable. Just recently, Tuesday, I went to speak to some students at Brotherhood Crusade that are working to be different than what is in their community. And I talked about my journey to this space so that they understand I'm from the neighborhood. I'm not from somewhere else. I didn't have a silver spoon in my mouth. And I've gone through some real trauma. And you can still make change. You can still give back to your community. You can change your culture. And I think that's a part of what we have to talk about. I know the students in Parkland, they are standing up, still even now, about what went on and how things need to change in their community. And they're not a big city like LA. LA is a huge city. LA County is even bigger. And to have folks that are really doing the work to make cultural and societal change, I think will be the difference in laws and just in the neighborhood.
Yeah, I think it's such a good point about sort of how do you shift expectations. But I think we have to also acknowledge, like, some of our systems need to change. When I was a high school principal, I had a young man who was, actually doing very well in school who started a huge fight. with other children. And, you know, fighting in schools is dangerous and gets out of control very, very quickly. And when I talked to him, you know, as a ninth grader, he basically told a story that I think is so familiar of, you know, he was being harassed at the train station, the subway station on the way home. This group of kids were pulling on his hoodie, etc. He saw, you know, and he was trying to figure out, you know, what to do to get it to stop, but it wouldn't stop. And he saw one of the kids by himself in the hall and decided, you know, preemptive strike was the way to deal with it. And, you know, in talking to him, I realized, like I said to him, well, could you have done anything else? Like, could you have talked to anybody? And he said, oh, no, miss. Like, I got to take care of business. Mm-hmm. Like, and I realized the failure is that there is no toolkit that this young man and most of my students really had around how to address the sort of everyday occurrences that young people face. You know, whether it's at the extreme of harassment, discrimination, and oppression, or it's sort of microaggression or bullying, or just not knowing how to handle your emotions and your relationships with others. We're not born with that. We've got to learn those skills. And we also have to give young people opportunities to thrive. When your son said, that person had nothing else to do, that should strike a chord with all of us of where solutions lie. You can't have high rates of poverty. You can't have high levels of racism. You can't have systems that are completely broken about helping people really live to their full potential, and then expect that we're all going to get along with each other. So, you know, I'd say we've got to focus on both the policies, but also what do we do with each other so that there are healthy relationships. I mean, dating violence, we're not even talking about sort of interpersonal violence, which is so huge and oftentimes can culminate, sadly, in the death of a person. Again, like, we need a different set of tools, and we need to really make some very different investments.
Talking about investments and Barbara's experience as an educator, you know, after Parkland, I created a Blue Ribbon panel on school safety here in Los Angeles. And some of the techniques that Barbara is alluding to still need to be put in place here and elsewhere. And I'll give some concrete examples. Barbara mentioned that isolated kid who's been bullied. I was talking with the person in charge of mental health for public schools in Denver. She was a student at Columbine when there had been a mass shooting when she was there. So she chose to devote herself to trying to grapple with that issue as an adult. In Denver, she said, we make sure that there's a relationship of trust between every student and at least some adult on campus. So that student, who's both more likely to be victimized and to be a victimizer, doesn't have those tendencies anymore. Then I talked to the superintendent of schools here about having a system in place. It could be a dean, it could be a teacher, it could be a custodian, it could be a coach, but someone who that child knows they can go to, whom they trust. Barbara mentioned other kind of preventative things. When a student goes to school through a neighborhood that is pervaded with gang violence, that student, we heard testimony as we're doing this panel around the city, that student may feel the need to carry a weapon with him, not because he wants to use it, but to defend himself. So what does that suggest? We should have safe passages to schools where no child feels the need to carry a weapon on that pathway to school, so there's not a weapon at school when that child arrives. There are so many strategies that are practical, common sense strategies, because every parent, in terms of common ground, every parent cares about school safety. Barbara has that experience as an education leader on a school campus, but we have experience also, all of us, as moms and dads. And we all want our child to feel the safety that very few children feel right now. We know that this is true. Parents and kids around the country don't feel safe right now with that child going to school. Part of that has to do with some of the conditions that I discussed earlier we can address. Part has to do with the flood of guns into our society. But the equation has many aspects to it, right? The preventative side is behavioral, but it also has to do with having access to weapons. Both those things have to be grappled with, and we know how to do it. We just need to make the commitment to take that action. And one reason I think we all are here is to try to raise that visibility so that no one feels they can be a spectator to this epidemic that we're confronting now.
So to a couple of the things that you said before, like if you're a witness to something, it obviously has a psychological change, but it also normalizes something. Once you see it, you think it exists. But at the same time, these preventative measures, how are they affecting our children as well? Because we were talking before we actually started to roll the cameras, these active shooter drills, what is that doing to the mind of a 5 or a 6-year-old who is now waiting for something to happen in fear, and they're going to have to take these actions?
It's so appropriate to, and I'm so glad you asked this question, it's so appropriate to understand the complexity of this problem.
Right.
And that there's
and we can't come up with all the answers, but...
Well, and there's no one single answer. So drills that let people know what to do to be safe in an emergency, a good public health practitioner is going to tell you that's essential. I mean, whether that's drills on how we're going to deal with an earthquake or a hurricane, depending on where you live, a pandemic, which we all just lived through, sort of strategies that actually help us in the moment when something bad is happening, have an idea of how we can respond to increase our safety, I think is important. But it has to be coupled with sort of the deep prevention. I mean, you don't sort of say, we're all going to prepare for the earthquake by doing drills about making sure we have a go kit, making sure we know how to communicate with each other. We're going to prepare for an earthquake by having safer housing. We're going to prepare by addressing issues related to climate change. We're going to really look at the issue with all of its complexities, and then have a whole set of strategies and responses that will help us feel safer and better connected to each other. And I think it's the same thing. If all you're doing is drills around how to respond in school, if all you're doing is drills in how to respond to a potential shooter, and you're not surrounding students with other opportunities, both to understand their fears, to deal with trauma or potential trauma, and importantly, to build their toolkit to avoid violence in the first place, then it's not a complete response.
And what I've heard from all of you is that loneliness seems to be a critical component to this. Loneliness and fear, and not having that person to go to. So where can we build up that, to your point, that one person that anyone can go to? And then also relationships, as you mentioned, with even those in authority, law enforcement, and how they respond to things. Where do we need to be creating toolkits and creating policies and creating information and making it widely available for all of those scenarios?
I'd like to say really at every level. I'm listening to the conversation, and I'm thinking about, my whole experience with my children, which was from a parent's point of view. And even when we got to the courtroom, and I really want to speak to the culture of gun violence and gangs, I was there alone because my children were isolated because I didn't know what else could happen when we walked out of the courtroom. And only one of my children testified, and he was protected when he got ready to do just that. The shooter had 23 people in the courtroom, friends, family, other gang members, and when he walked out completely chained, they clapped, waved, whistled. It was a huge cultural thing. And I can't say it enough times, like, we had to break that cycle where it's acceptable to take human life or or to attempt to take it for a property, a territory that you don't own, you don't have a title on, you're never going to have a title on it. And so it has to start really in the grassroots level, not only in school, not only in law, but I think that there's a big separation between humanity, like this is a real human life that will never be recovered, like you said, and also the experience that everyone that was touched by the gun violence. So my kids were in college, so that meant all their teammates were affected, all their cousins were affected, everybody in the neighborhood was affected. And that's a grassroots level where they're negatively affected and trauma occurs. And then on the other side, there are people that really applauded the efforts and they're not seeing that as trauma, but it really is. It really is. And I think that's where the crisis is, that they run together. And the mental health piece is that it was hurtful for everyone, and hurt people. They just, it's a cliche, but it's a real thing. And it has to be a part of the bigger conversation, just like wear a mask was, right? In order for people to have awareness, we have to have the discussion about this is not okay. You can't, lock your gun up and take care of your whole neighborhood. Like, don't make anybody an accidental victim, not just an intentional victim, because we have those accidents too.
Can we put policies in place?
Yeah, and one of the things that we've been alluding to is we have to put resources where we know they belong. So for example, in our public school system in Los Angeles, there's a national standard for the number of psychiatric social workers that should be available to kids. There should be one for every 250 kids. At LAUSD, there's 1 to 1,000. We've made a choice as a society not to allocate those resources to helping kids where they're in a moment of crisis. In the wake of the pandemic and with all that's happening around the world, everybody is uptight. Everybody is on edge. And there's a lot of social division in our nation that some politicians choose to try to fuel as opposed to try to dampen. So what do we do about that? Well, first, in schools, we need to be accompanying academic learning with discussions about looking out for each other and developing relationships of trust with each other, caring about your classmate and your schoolmate, candid conversations about how to develop some cohesiveness in a world where people are very atomized. People are very distant from each other now. I think some of social media fuels this too. But I get concerned when I hear politicians only attribute the violence that we're seeing in our society to social media or other issues, because that's a cop-out. That's a way to divert attention from the fact that other societies around the world are grappling with these same social issues that we are, but they don't have the rates of gun violence that we do. There is a major difference, not in access to Facebook or similar social media tools. There's not a difference in terms of how people feel in the wake of the pandemic and isolated from each other, but there is a huge difference in rates at which people kill each other with guns. And so I think it's important for us not to lose sight of that crucial piece. As Barbara said, there is no simple solution here, but there is a comprehensive set of policies that we could adopt that could do better.
I want to bring up something quickly, specifically for women and girls that are suffering violence. I'm working with my colleagues in the Civil Rights Department in the city of Los Angeles to put together a digital and a physical resource guide, so that if they are feeling something, they can reach out to any of these entities throughout the city, so it's northeast, southwest, and if they're feeling of any violent trauma, they can make a phone call. So that goes to what you said, especially with the violence that happens in a relationship. But the relationship doesn't necessarily have to be intimate relationship. It could be, adult, child, any of those things. So we are putting together a guide that folks can either click on and get information and try to get help, or a physical guide that you can carry it'll be like a brochure, so that you will at least have a resource guide if there's a issue that you can't explain to your parents or your loved ones, and you could speak to a professional.
Speaking of resources, I mean, we could, and I hope we get to continue this conversation again at some point, but there are absolutely no solutions necessarily at this moment, but talking about it is going to maybe light some fires or spark some ideas and everything. But what is available right now? What is available in this whole realm from a public health standpoint that we should be taking advantage of, that maybe people don't even know exist?
I really want to applaud, the council member and Mike for, understanding that the policies really do matter, and easy access to resources when you need them are going to matter. I want to note that there are a lot of resources that particularly people who are experiencing violence can make use of. I mean, one thing I want to highlight is that you can get a gun violence restraining order. We're doing a ton of training. I think we kicked off our first training yesterday, really to help people understand how easy it will be to go ahead and file. That includes making sure law enforcement has those tools as well as the general public. But I want to note that if you think a person is of danger to themselves or to others, or to you personally, you can go ahead and file to make sure that they don't have that access to guns. And it's super underutilized here in LA County. At our website, at publichealth.lacounty, you can go ahead, .org, you can go ahead and get a whole list of those resources. We have regional coalitions so that we can do that culture change and really look specifically in neighborhoods at what, in fact, neighbors want to work on together to reduce the impact of violence. I want to say we have a huge trauma initiative that really helps people who have experienced violence who are at the hospital. I don't think anybody should minimize how horrifying it is when people are hurt and they are hospitalized, for the families and the survivors to really get the kind of care that they need, and to make sure that that's trauma informed, and that we're staying with that survivor and their families for months and months and months to help with the healing and the recovery. We also have healing centers all around the county now that really acknowledge, for all of us, we have different ways to heal, but many people experience trauma, and without healing, you become a hurt person who may, in fact, end up hurting others. That healing looks different. For some people, it's a real involvement in the arts. We have women who have experienced the loss of someone from violence who are doing big projects on quilting and crocheting, and again, giving back to the communities. We have a whole drumming and arts program. We have talking with others, being in a support group. Because for many people, counseling, individual counseling, may not be the route that they want to take. We have to offer a whole set of opportunities for people to heal. And then on the prevention side, we talk a lot about trauma-informed services everywhere, from law enforcement to schools to healthcare. People need to understand the impact, at this point, the pervasive impact of trauma on how people will respond to certain situations, and try not to create unintentionally situations that bring out, in fact, a response that will heighten insecurity. Sure. As opposed to trying to create more safe spaces for others.
Well, I can't thank all three of you enough. I know that we've really just touched the tip of the iceberg here. However, what you have said today is profound and from your perspective, and I think is really going to get people thinking. So I just really want to thank Dr. Ferrer, Heather, Mike, for your time, for your thoughtfulness, and for the work that you're doing in this realm. And I certainly hope that we can continue the conversation further.
Thank you, Maria.
Thank you, Maria.
Good to be
here. Thank you very much.
Well, we certainly hope that you have gotten something out of this, and be sure and reach out to us or all of our guests today if you have more that you would like to bring to the table and to talk about. I'm Maria Hall Brown. Thank you for joining us.